Welcome back to Vetcare. Today, we're talking about something every animal owner should understand: fever in animals. Fever, also called pyrexia, is when the body temperature goes higher than normal. It is controlled by the body and not caused by the environment, like hot weather. Fever is different from hyperthermia, which happens when the body overheats due to outside heat and can't cool down properly. Fever happens because of an infection or inflammation, so it's like a combination of hyperthermia and infection or inflammation. Fevers can be divided into two types, septic and aseptic. A septic fever is caused by infections, like bacteria, viruses, protozoa, or fungi. These infections may be localized, such as an abscess, a lump filled with pus. Cellulitis, skin infection. Or empyema, pus inside the chest or other cavities. Intermittently systemic, sometimes in the blood. Like bacteremia, bacteria in the blood. Or endocarditis, infection of the heart's inner lining. Or fully systemic. Like septicemia, a severe blood infection, also known as blood poisoning. An aseptic fever happens without an infection. These are caused by chemical reactions, such as when a foreign protein or drug is injected. Surgical procedures, which can cause fever due to tissue damage. Tissue necrosis, death of body tissue, like after an injection with damaging material. Severe hemolytic crises, when red blood cells break apart and release hemoglobin into the blood. Infarctions, blockage of blood flow causing tissue death. And immune system reactions like anaphylaxis, a life-threatening allergic reaction, or angioedema, sudden swelling under the skin. Now let's talk about how fever develops, or its pathogenesis. It all begins when the body is exposed to pyrogens, which are fever-causing substances. These can be exogenous pyrogens, like bacteria, viruses, fungi, or bacterial toxins such as lipopolysaccharides, LPS, from the outer membrane of certain bacteria. These exogenous pyrogens or any injury or inflammation in the body trigger the body's immune system to respond. In turn, the immune cells like monocytes, macrophages, and granulocytes release endogenous pyrogens, which are mainly cytokines. The most important cytokines involved in fever are interleukin-1, interleukin-6, and tumor necrosis factor alpha. These cytokines travel through the blood to the hypothalamus. They don't act directly on body temperature but stimulate the hypothalamus to produce a special chemical called prostaglandin E2. This prostaglandin is responsible for actually raising the body's temperature, set point. To reach the new higher set point, the body begins to generate and conserve heat. Blood vessels near the skin narrow, vasoconstriction, to reduce heat loss, and the animal may start to shiver, which is muscle movement that produces heat. Other signs may include raised hair, piloerection, and the animal seeking warmer places. All these actions raise the body temperature until it matches the new set point, resulting in a fever. Fever usually has three phases. First, increment phase, chill, this is the beginning stage. The animal feels cold and may shiver. Blood vessels tighten to hold heat inside. The body temperature starts to rise quickly. Second, vestigium phase, constant temperature, this is the stage where temperature remains high. The body adjusts to this higher temperature. Metabolism speeds up, animals may eat less, and in animals like cows and sheep, ruminants, stomach movement can slow down. Third and last, decrement phase, defervescence, this is the cooling down stage. The body removes heat through vasodilation, opening of blood vessels, sweating, and relaxing muscles. the temperature gradually returns to normal. But in very sick animals, especially with toxemia, toxins in the blood, the temperature can suddenly drop too low, which can be fatal. Signs of fever include a high body temperature, faster heartbeat but weaker pulse, hyperpnea, rapid breathing. Tiredness, muscle weakness, oliguria, less urine, sometimes with protein in it, albuminuria, polydipsia, increased thirst, anorexia, poor appetite, small or reduced amount of stool, often due to dehydration or reduced food intake, and depression. Fever can show up in different patterns depending on the disease. One type is ephemeral fever, which is short and usually lasts just 1 to 2 days, like in bovine ephemeral fever. In a sustained fever, the body temperature stays high all the time with very little change. A remittent fever means the temperature keeps going up and down, but it never returns to normal during the illness. In intermittent fever, the temperature rises for a while, then goes back to normal, and this cycle keeps repeating. A good example is equine infectious anemia. Lastly, a biphasic fever happens in 2 stages. The temperature rises at first, drops back to normal, and then rises again. This pattern is seen in diseases like strangles in horses and leptospirosis. Knowing an animal's normal body temperature is key. Here are the average rectal temperatures for common animals: cattle, 101.5 to 103 degrees Fahrenheit, horses, 99.5 to 101 degrees Fahrenheit, dogs, 101 to 102.5 degrees Fahrenheit, cats, 100.5 to 102.5 degrees Fahrenheit, sheep and goats, 101 to 104 degrees Fahrenheit. Laboratory tests help confirm fever and find its cause. Early in a fever, there may be leukopenia, low white blood cells, while later stages may show leukocytosis, high white blood cells. A protein called fibrinogen usually goes up. Blood cultures, blood smears, and serology, blood tests for viruses, are useful in diagnosis. If an animal dies with fever, postmortem findings may show vascular congestion, blood-filled vessels, early rigor mortis, stiff body after death, and fast putrefaction, decay. The original disease often shows its own unique signs during the examination. Treatment depends on the cause of the fever. Antibiotics should only be used for bacterial infections, and the choice, method, and length of treatment depend on the infection's type and severity. In animals with a fever of unknown cause, using broad-spectrum antibiotics might seem like a good idea. However, giving treatment without knowing the exact cause, blind therapy, is not recommended. It can cause harmful side effects, lead to infections from drug-resistant bacteria, and make it harder to find the real cause later through lab tests. Fever-reducing drugs like NSAIDs, nonsteroidal anti-inflammatory drugs, such as flunixin meglumine, must be used if the fever gets dangerously high. To see complete information on NSAIDs, including which NSAID is safe for which species and at what dosage, check out our detailed video linked in the description below. Supportive care is also very important. This includes cold water sponging or using ice packs on the head and neck, diuretics, to help remove toxins through urine, steroids like dexamethasone or prednisolone to prevent shock, multivitamins, minerals, energy-rich diets, and fluid replacement using glucose, normal saline, or Ringer's solution, especially if the animal is dehydrated. It's important to remember that mild fever often helps the immune system. And that's a full look at fever in animals. Not every fever needs medicine, but every fever needs attention. If you learned something today, give this video a thumbs up, share it, and subscribe to Vetcare for more clear and simple veterinary info.